whole goal of studying for the NCLEX exam is related to having the ability to answer questions. That's the whole goal of studying for the NCLEX exam. Everything you are doing is trying to have the ability to answer questions when you see one on the NCLEX exam.
Right.
Right. So I will show you my way of answering questions so that you can be able to understand and utilize the flow. It's not about the answer. I've been coaching for the past 2 years and I don't really care about the answer any student is giving. The only thing I care about is how do they answer the question? Because that way I can start evaluating if you are thinking as a nurse as well too, if you are understanding the question. That is how I can easily know, right? Because me, there are some certain questions I might not get them correctly, right? Because yes, there's nobody that cannot fail question. It's question at the end of the day, right? Nothing itself give you privilege to make one or two mistakes, then get it right. Exactly. You see patients in the ward, they present to the unit. Initially, doctor will give them a particular diagnosis. All of a sudden, doctor is like, "Oh, we need to change this diagnosis. We thought the patient is having this, but no, that's not what the patient is having. This is what the patient is having." Then they change the diagnosis. So these are things that happen. But guess what? If you like get it wrong on the NCLEX exam, it's a wrong answer. But at the end of the day, if you are well prepared for the NCLEX exam, you are going to get more questions correctly than the ones you are going to get wrongly, and you have the ability to pass the exam. So the ability to see a particular question in the NCLEX exam, answer it correctly, there's a blueprint. There's a blueprint. The moment you can like have everything all checked, when you see question on the exam, you have the ability to answer it correctly. Right. I like starting with understanding what the NCLEX is all about, because the moment you understand what the NCLEX is all about, you have this kind of thinking related to what you should expect, right? It's just like when you are watching a football game, you don't expect to see tennis there because you understand how football game look like, right? So now expectation and working towards those expectations give you the result that you want as well too. So same thing with the NCLEX exam. Now, what are those things you need to know so that when you are taking the NCLEX exam that day, you'll be able to know how to answer the question? Right, which is one, you need to understand what the NCLEX is all about. A lot of students, they just only know the surface definition of what the NCLEX is all about. If I ask now, what's the NCLEX all about? The first thing that we are going to say is NCLEX is a particular exam that gets you license. What is missing in that definition is how. Now, another student might not tell you, okay, you just need to pass the exam. Once you pass the exam, you get license. This how still remain again. How do I pass the exam? Then the next thing the student might not say is, okay, get a program. Most likely, everybody, maybe someone has recommended a particular question bank program to you. Now, if you don't understand the reason why you are failing the exam, it will be difficult for you to succeed. Right? It's just like now, two patients can have hypertension, and the reason why this patient is having hypertension might not be the same reason why this patient is having hypertension. Though they both have the same hypertension, but this particular patient might be having hypertension due to kidney problem, right? This patient might be having hypertension due to the blood vessel problem, right? So you imagine their result is both hypertension, but not the same cause. That's why you learn risk factor related to various diseases, because what is causing one condition is different from what is causing another patient what condition. That is how NCLEX work as well too, right? Because you have a student that is very smart in nursing school and end up passing the NCLEX exam, does not mean our own approach will be the same that will work for you. You need to ask yourself, the same way she was able to pass, right? she walked through a certain process. The process is what you want to know, right? Because once you know this process, you can walk through the process and immediately you start seeing the area you have difficulty. You will never see difficulty if anybody recommend question bank to you. The only problem you'll be fighting with is why am I having 60s? Why am I in the 60s? Why am I in the 70s? Whereas many people are in the 80s, they feel ready to take the exam, something like that. But score don't guarantee if you will pass. I've seen someone that had 90, right, in a particular question bank and still end up failing the exam. So it's not about the score, it's about the checklist that walk you towards passing the exam. The first thing is remove your mindset from thinking as a nursing student, switch your mindset to start thinking as a nurse. In order to start thinking as a nurse, you need to understand the role, duty of a nurse, right? One, what is nursing? Nursing is the aspect of what? Caring. What is a nurse? A nurse is a person who now carry out that particular care. So if nursing is all about caring and a nurse is someone who carry out care, now the next thing you need to be asking yourself is what kind of care will I carry out? Right. Where, what kind of care will I carry out? Where will I carry out these cares? So this is what NCLEX is testing in order to see if you are a safe nurse. Simple. The what and the where. Today you might be in med-surg unit in a particular question. Tomorrow you might be in maternity unit in a particular question. You might be in the emergency department, a lot, pediatric and a lot, right? The what kind of care, you should know this. Like if you wake up in the middle of the night and somebody's asking you what kind of care are you going to be offering as a nurse, you need to be able to list all these things because it's something you need to know. This is what NCLEX is testing. Your ability to give medication, communicate, document, assess, evaluate, intervene, create plan, intervention. A lot of these things, procedure, nursing skills. These are things NCLEX is testing, supervising. A lot. The only simple task that you have right now, right, is to see the aspect of care that NCLEX want to test you on in order to know if you are a safe nurse because NCLEX is trying to meet a particular requirement in order to show that you are a safe nurse. So what are these requirements? These requirements, right, we have them on the NCLEX test plan. Now, the duty of the student is to go to that test plan, see what the NCLEX want to test, so that you are prepared to show the NCLEX examiner that you are a safe nurse. That way, you end up getting your license. So, a student is not thinking like this, and they think the first thing they need is question bank. Yes, many students pass, they tell you they use question bank, but behind the scene, it's not question bank. I've said this many, many times. Now, if a particular student feel like it's this question bank that made them to pass, right? Give this question bank to a non-nursing student and see if they will finish this question bank and pass the NCLEX exam. No, because they don't have the existing knowledge of nursing. So the ability to use a particular question bank and end up passing the NCLEX exam is not because of the question bank. It's because of the existing knowledge you have. The question bank only trained you on your existing knowledge. If you are looking at a particular question and you have to second guess it, try to see if you can answer it, you are not sure about what the question is testing, that is where you start finding the problem. That's where you start finding the problem. Right. There's a roadmap that is 100% once you follow it, you have the ability to pass the exam. There's a roadmap. You just need to understand one, how do NCLEX write the question? What content is the NCLEX test? I always used to tell students the reason why students fail the exam every single time is because of these three things. I've seen this for the past 2 years, right? Because of these three things, I call it the CWU content, right? Understand. It's either the content that is causing them to fail, right? Or they don't know how the NCLEX write the exam. They don't know how to understand. If I ask many students, do you know the content that will be tested on the exam? They will say, yes. I've been using a particular question and program. They will say that they are using MATK, Remanosing, different things. So I'm like, okay, mention the list of content that will be tested under management of care. You failed the NCLEX exam before, right? They will say yes. You saw your test report or your candidate performance report, which we call CPR. They will say yes. You saw those areas you had above the passing standard, below the passing standard, near the passing standard. They will say yes. Now, let's start with those areas you had below the passing standards. Okay. What's the first on the list? Maybe infection control. All right. List just three content that the NCLEX want to test under infection control. They say, maybe TB. TB is not a content. TB is a topic under a particular content. Give me the main content. Many students don't know it because how are you going to? It's just like when you don't know the content, right? You are going to gamble the exam. That's the reason why I always used to say this. Giving a patient medication, because not knowing the content before you take the NCLEX exam is like giving a patient medication without not knowing their diagnosis. Guess what? You will put the patient life at what? Risk. So you want to know the content so that you know what you are doing when you are answering the NCLEX question. The moment you are reading a particular question and you don't even know what the question is all about, I'm scared for you. Many programs don't write question related to the NCLEX content. They write question related to what they think that the NCLEX want to test. There's a different. It's a different thing entirely. If there's no program, trust me, many students will still pass the exam. Because even the NCLEX writer, they created a program to help students pass. They stopped 2021. Guess what? We still have 94% students passing the NCLEX exam regularly. So the ability to pass is there. The problem is if you are failing, you need to realize what is making you to fail. Is it that the content you don't know? Is it that you don't know how the NCLEX write the question or you don't know how to understand? But guess what? You need these three things in order to be able to pass. You cannot escape it. This is your roadmap to passing the exam. You can either ignore it because you like failing or use it because you know that you are not wasting time, but you are wasting opportunity. Because many students will reach out to me, they say, Coach, I have time. I'm trying to take my time. Right. You don't have time. You are wasting opportunity because you were not ready to do nothing for just you maybe just wake up and you say you just want to do nothing. You have this interest in doing nothing. So if you are not where you want to be right now, it's not wasting time. You're wasting opportunity. There are a lot of things you would have achieved being as a nurse. You know them. By the end of the day, what is holding you back is not the time that you feel you have. It's the ability to prioritize what is important now. So in order to answer question, you need just one thing, right? Know the content. Once you know the content, now, second thing, know how the NCLEX writes the question. When NCLEX want to write the question, right? Let me show you now. NCLEX have three parts to every question, right? See this first part right here, this second part, and this other part. This part is called the body of the question. This part is called the stem. This part is called your answer keys, right? Now, the body of the question, like I always used to say, is like reading a storybook. Right. That is like the body of the question. Like if I ask you, all right, I want you to read this storybook. When you are done, I'm going to ask you a question. Right? That is how the body of the question look like. The body of the question is like the storybook that you want to read. You want to have a perfect understanding of that storybook so that when I ask you the question, you'll be able to give me the correct answer. Your ability to give me the correct answer is when you understand the body of the question. Same thing with the NCLEX exam. If you don't understand this part of your question, right? You will not be able to select the correct answer. You might likely select the correct answer, but you will struggle. So you now have to decide, do you want to struggle with the NCLEX exam, or you want a way that you don't even feel like you are taking the NCLEX exam? It looks like a practice test. I was taking my exam. Trust me, I did not even realize I was taking an exam. I was just smiling. Right. I was just smiling because I already know audio process. Like I know how the exam work. I know how to I literally knew what the question we're asking. Yes, I had difficulty selecting most answer within 30 seconds because my whole goal is to select one answer within 30 seconds. It took me time to select most. There are some questions it took me even more than 2 minutes, but not many, not so many, right? When I was taking the exam, I realized that 1 to 11, like 1 to 11 question, I was just like I can tell you I'm 100% sure of those answers I selected. When I saw question 12, I was like, okay. I had to like receipt back again, look at the question. I went through it. I was like, okay. I selected answer. All my answers that I selected, even when I was not that sure, I can tell you 75% that I was sure about the answer. There was no one I was like, oh, I'm not sure if I will get this answer correct. I was 75% sure that I'm not really aware of the correct answer. Number 1 to 11, I was 100% aware of the correct answer. So I'm 100% sure I got that. So imagine this is your scale for above the passing standard, because you have something like this. The passing logic is for passing standard for RN is 0.00, right? So you have like this area where you have near the passing standard, you have above here, and you have below here. Now, this is your like number one question all the way to 85 question, right? Now imagine I'm 100% sure I scored 11 questions, the first 11 correctly. I'm 100% sure. Now I will be above the passing standard 11 times. Now, the reason why I will drop to near the passing standard or below the passing standard is if I fail 11 questions straight. That is when it's even 12 questions I need to fail in order to drop near the passing standard. That is how I can fail the exam. So this is the power I'm trying to give to you. The ability to score more questions that you are very far from near the passing standard, like you are far from this line that puts you near or below the passing standard. In a way that the only reason why you fail the exam is if you miss as a lot question more than the ones you've gotten correctly. I'm telling you, if NCLEX give most students the ability to see their exam scale, they are like this on the exam. And then they fail when they are below. I'm telling you, demonstration has been made from many student exam, right? Why student fail? It's on the NCLEX website. There are some videos like that they made demonstration on some student real life student skill, whereby they tell you, look at it, see this particular student, how the student was answering question, keep on dropping. Some students, if they get two questions correctly, the next three they are getting it wrong. Some students, if they get one question correctly, the next 4, 5 questions, they are getting it wrong. I've seen a particular student that was evaluating this particular student. This student got 10 questions wrong. So if a particular student got the first 10 questions wrong, please tell me, how do you feel like, do you think these students will have the ability to get? Because before the student can pick up above the passing standard, do you know that this student need to score more than 11 questions to be above the passing standard? So a particular student who got the first 10 questions wrong, now the chances of getting 11 questions correctly, is it possible? Let's be real here. It's not possible. Right, she might do well in the next 10 questions, maybe probably she score maybe like 5 and miss another 5. Guess what? She has not yet regained those lost points. She's still below the passing standard. So the chance of even missing 10 questions give you the ability to miss more. 10 out of 85 questions, you are left with 75. 15 is not going to be scored. You are left with 60. The NCLEX is no joke because you have small amount of questions to be above the passing standard. So how do you work towards being above the passing standard? You need to take every question seriously. Many students, when they are reading the question, they are like, The charge nurse has received a change of shift report of the following client in labor. The charge nurse must have a staff member to first see the client in the first stage of labor. Where are you rushing to? You barely even understand what the question is even asking. You barely have even positioned yourself in the unit to understand who is in this situation. And you want to answer the question, do you think it's by guessing it? You don't even know your duty as a nurse there. You don't know the nursing care that the NCLEX is trying to test. One, you need to understand something, which is when the NCLEX is testing you, right? NCLEX is testing you towards a particular hospital setting that a lot of people are in that settings. We have the doctor, we have the pharmacist, the respiratory therapist, name it, staff member, LPN, right? Charge nurse, UAP, you the nurse, the client, the family member, visitors, loved one, spouse. Everything that is bringing all these people together in that particular hospital settings is the care. It's the care. So what are these cares? That's what you are looking for. What are they? When the nurse is communicating with the spouse, why is the nurse communicating with the spouse? Because the spouse might not even be the one that needs the treatment. It might be the client that needs the treatment. But what is bringing the spouse and the nurse together in that question? Because sometimes you might have the client in that question, the main person that needs the treatment, but the question is not even related to the client. It's related to the spouse. Sometimes you might have a question and the question is not even related to the client. The problem is with the nurse. Imagine if a question is testing you on a nurse is observing a staff member caring for a client who have chickenpox. Who is the NCLEX testing you on? The NCLEX is not testing you on the client who have chickenpox. Instead, the NCLEX is testing you on the staff member because your duty in that question is that you are observing the staff member. So if you don't know what the staff member is doing right or wrong, guess what? You will fail the question. If your focus is on the client, guess what? You will also fail the question. So your first understanding comes from the body of the question. You want to understand the body of the question related to nursing. So that's where most students start seeing their problem. They realize that they don't know the nursing care. They only know about their nursing courses. NCLEX is not testing courses on the exam. NCLEX is testing care. You need to be familiar with those care and they are on the NCLEX test plan. Management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, reduction of risk, pharmacology and parenteral therapy, physiological adaptation. You should know this by heart because the care that NCLEX will test are under each of these client need. So what are those client need under management of care? You need to know them so that when you see a particular question, you can easily identify the kind of care NCLEX is testing. Like in this question, the question is talking about the charge notes. The question is talking about change of shift report. The question is talking about client, but not client just anywhere. They describe the location, which is related to what? Labor. Each unit have their specific way they care. So if NCLEX just give you client, it means that NCLEX is trying to tell you it's a random kind of care we are talking about, right? Care that apply to every patient. But if NCLEX tell you client in pediatric, client in labor, client in emergency department, NCLEX now want you to start thinking about the related care to that particular settings. Because the particular care you are going to do for clients in maternity is not the same kind of care you give for clients in pediatrics. It's not the same kind of care you give in med-surg. Most especially if NCLEX is testing you related to vital sign for pediatric or vital sign for maternity or vital sign for med-surg. We don't use the same vital signs. If NCLEX is saying respiratory rate of 34, and then you are like, oh, that is too high. High when the NCLEX is saying pediatric or when the NCLEX is saying newborn, the reason why you jump into conclusion saying it's very high is because you do not pay attention that the NCLEX is talking about a pediatric or newborn client. So you need to be careful when you are selecting your answer. And carefulness all come from understanding the kind of care you are offering. So now if I see this particular question, the first thing that comes to mind is, what are we doing right here? Remember I said the body of a question is like that storybook. You understand the storybook. I ask you a particular question, you answer the question correctly because you understand what is in that storybook. Your ability to answer every NCLEX question correctly is understanding the body of the question. So that's what I want to do in this session, right? I want to make sure I show you how to understand this question. So now I will leave you with the ability to be able to critically think through your nursing care, because it's about nursing care that NCLEX is testing. NCLEX is not an environment that you want to cram. Nursing school, yes, you can cram, but you need to understand what you are doing when it comes to the NCLEX, because retaining information is nursing school. Using those information to care for real actual clients is what the NCLEX is all about. So let's start. Now, this question now, we have the body telling us about a charge nurse receiving change of shift report on the following client in labor. Remember, you are not a charge nurse, right? You work under a charge nurse. You are even starting nursing, so you cannot even be a charge nurse immediately. You don't have that experience to yet be a charge nurse, but you are going to work under a charge nurse. So NCLEX expects you to know the duty of a charge nurse. In short, charge nurse coordinates everything in the unit, right? There are a lot of things they also do, like they manage assignments, they receive reports in order to start telling you who are you going to be working with for that day and something like that. Now, I don't want to waste our time, so let's just go straight. In this case, the charge nurse is receiving change of report. Now, if I go on Google right now to ask, maybe I go on Google or I go on ChatGPT to ask about change of shift reports, right? And I say, after change of shift report, what occur after change of shift report from the charge nurse? You will see Google or ChatGPT will either say, we say, is either the charge nurse is going to start delegating tasks or she's going to ask for you to prioritize a particular patient. It's always these two things that come after change of shift report, right? She will start delegating the tasks and say, okay, all right, I want to assign patient 1, 2, 3, 4 to this particular nurse, patient so to this part. That's what she will do. And also she might tell you, okay, because of this patient is having so and so, I want you to see this patient first. You see, along the line, she's doing delegation and she's also doing prioritization at the same time. So now when you understand the body of the question, you have the ability to start now thinking like, okay, this question can either be related to delegation or prioritization. Now, if your thinking is not matching what the examiner is asking, trust me, you don't understand what the body of the question is all about. You need to go back and understand it. If your thinking is not matching it, you don't understand what the body, because the understanding of the body of question should match what the examiner will ask. So when many students always used to say, I don't even know what the examiner is asking, I was just there, I was blank, it's because they don't have an idea of what they were doing as a nurse. I don't know the nursing school you attend, what nursing school you attended, but my nursing school made sure that we are used to nursing care, not just all about studying in nursing school, but they put us like in charge of most things. So we know many things, right, related to hospital settings. And exactly what we know is what the NCLEX is testing. So I know the duty of a charge nurse. I've worked under a charge nurse. I've gotten instruction from a charge nurse. I know the charge nurse will be there to get the report. She will make the assignments. She will assign staff. I know all these things. So I'm not shocked when I'm seeing the NCLEX saying the charge nurse has received a change report. I know what she will do next because I'm used to it. And even if I don't know what she will do next, it's on the NCLEX test plan that the NCLEX want to test these things. So what do I need to do? Google is your friend. Just put the information that NCLEX want to test and say, when NCLEX want to test this, what should I know as a nurse? Simple, because NCLEX want to test what you know as a nurse in order to act right. So if I go on Google or maybe ChatGPT, okay, for this content, what do I need to know about this content? It will break it down so you understand how to now use it to think as a nurse. So I know and I know. So now when I see the STEM and the STEM is saying the charge nurse should ask a staff member to foresee the client in the, I already know what the question is all about. Now, let me tell you what can stay with you forever. Many people think I talk too much, right? Or maybe I like spend a lot of time explaining things, but they don't really know the advantage of it. I'm trying to like remove the ability of cramming, because imagine you have to write 3 nursing exam and you are telling me you have to read 3 times to pass 3 nursing exam. It makes no sense. It means that the information you need to do exam 1, you lost the information you need to reread again in order to do exam 2. You lost this 2 information you need to read again to do exam 3. I've written 3 nursing licensure exam and I only read 1 time for the NCLEX and I was able to pass the 3 exam without not reading again. Nursing knowledge should stay with you forever. The moment nursing knowledge is not staying with you forever, you are cramming. That is the main reason why when someone finish NCLEX, you are not ready to start working as a nurse. And that's the general complaint that created what? The next generation NCLEX. Because the complaint is that nurses are not ready. So what should they do to make them ready? They added what? The next generation NCLEX, whereby you get your case study, because now the case study is just like the charge nurse has assigned a particular patient to you. If you can be able to succeed related to case study on the NCLEX exam, that is the same aspect of nursing care when you start working as a nurse. So if you know how to do case study, you have the ability to care for a client without no problem or assistance when you start working as a nurse. Right. So that is how that is how it works. But guess what? Some people are still even finding shortcuts to answer case study. Like they are not ready to even understand case study. They are looking for somebody to give them a shortcut to like answer case study. Sorry, there's no shortcut. You need to understand nursing care. So my explanation is full of the right understanding that walk you through nursing understanding and nursing care. So if you are listening to me, you are not listening to the answer I'm selecting. You are listening to how I am answering the question 1. 2, you are paying attention to how I am explaining what you are doing in that question as a nurse. This is how you start thinking like somebody that will pass the NCLEX exam in 85 questions. Except if you want to struggle, right? But I'm not here to make you struggle. I'm here to make you understand the principle of nursing care. Everything in nursing are related to principle. Go back to the aspect of theories, nursing theories. Everybody have their principle of nursing care. If a patient is this is what we need to do. If a patient is that, this is what we need to do. That is nursing. Nobody was like, this is a strategy to treat a patient who have HIV. There's no strategy. Right? Strategy come from me trying to explain something to you in a fancy way that your brain pick it up. You know, our brain is excited about many things. If I ask you, let's watch a movie together or let's read, the first thing you will tell me is let's watch a movie together. Reading will not even be your thing because reading we know it come with high level of stress. And guess what? Our brain control our mood. The moment our brain can pick the fact that we are not ready to study, it send bad signal. Then everything gets to be depressed in the body and then you are unable to read. That's the reason why when students see you answering question in a way that nobody have answered question like that, trust me, they easily pick the understanding and they want more because the brain likes something that is very exciting. So if I post a particular video now and I say, look at this strategy that you can use in order to answer select or apply question, I will get thousands of views. But out of these thousands of views that I have right now, those thousand people that watch the video, are they going to be able to pass the exam based on that strategy? No. Because the strategy is not what will make them pass. All what they are looking for in the first place is easiness to answer question. And there's no easiness to answer question. You just need a smart way to go through your question. Right. If you are watching a particular video and you can only use that video to answer one question, you need that person again to explain another question to you. You are not learning. Right. You should be able to watch a particular video and you have the ability to learn from that video that give you the opportunity to even do many stuff by yourself. This is what I call learning. And this is what I build my coaching program on. The ability to hear one statement from me that give you the ability to answer many questions. If you are not living with anything today, you should live with the ability to understand the body of any question on the NCLEX exam. Nobody will take that away from you. That's why many students, there's a particular student, right, that was saying, somebody was asking, where do you learn how to break the body of the question so nice like that? And she was like, oh, I learned it from a particular coach, right? the ability to break questions, because many people, if they can just have a better understanding of the question, they can easily walk themselves through the answer, because most answers you will select on the NCLEX exam might be related to just common sense. Right. So when that student learned, right, that same way, she did not join my coaching program. She learned from somebody that joined my coaching program. She ended up passing her own exam in 85 questions. And she reached out to me. She was like, "Oh, I did not join your coaching program. I saw my friend answering question. I loved it. She told me she learned from you. She taught me. And I learned those concepts. I took the exam. I passed in 85 questions. I just want to thank you, even if I did not join your coaching program." Right. So the ability to understand the body of the question is key. It gives you the ability to answer the question successfully. So let that stick. When you are trying to answer any question, I don't know where, but the best recommended place if you want to get the best value is using the NCLEX past question. That's the reason why you always see me using two important tools created by the NCLEX writer themselves, which is the NCLEX test plan and the NCLEX past question. Because you want to get what will be on the exam, not what will not be on the exam. Who can create the NCLEX question better than the NCLEX writer? It's the NCLEX writer. So why running after a particular question bank that you might not gain the right information you need? So understanding the body of this question gives us the ability to know it's all about delegation or prioritization. And when we saw the stem of the question, is related to what? Prioritization. So now, all we just need to now do is to apply the principle of care related to prioritization. Prioritization rules state that you need to know what you are prioritizing. In this case, we are prioritizing clients. Sometimes we don't prioritize clients. It's not all the whole time that we prioritize clients. Sometimes you might prioritize procedure, you might prioritize treatment, you might prioritize medication, you might prioritize task. Like there's a lot of things you prioritize. You need to understand. In this case, we are prioritizing patients. So since we are prioritizing patients, there's a principle towards towards prioritizing patients, which is the principle of immediate attention or the principle of picking a stable patient, because there are two ways you can prioritize clients. Is it that the NCLEX wants you to pick the patient that require immediate attention, or the NCLEX wants you to pick the patient that is stable? Right, it's in two ways. You need to understand it. Like this particular question, obviously, wants you to pick the patient that is not stable. Now, if the NCLEX now tell you you are trying to prioritize clients in order to make bed available, right? Because the NCLEX use this keyword bed available, it means the NCLEX wants you to prioritize what? A stable client. Right. It's still prioritization, but NCLEX wants you to prioritize what? Stable clients, right? So I've explained this. Now, next question, which is right here. Now, the body of this question is saying the nurse is observing a staff member caring for a client who has chickenpox. Now, who do we have in this question? Now, in this question, now the question is not testing anybody. Instead, the question is testing you. You were not the child nurse in the previous question, but now you are the nurse in this question. Right. So the NCLEX is testing you. So what are you doing in this question? You are observing a staff member. So your duty in this question is you are observing. So guess what? If the examiner question is not related to you observing the staff member, trust me, you've not understand the question. Because the question is not testing the client about the client. The question is testing this. Your duty is observing the staff member. So the examiner question should be related to this. But the whole thing that you're observing is the care of a client who have this. Right, but the staff member is the main focus in this question, not the client. Now, that's why the examiner question must match our thinking. That's why the question is like, which of the following what action by the staff member would require the nurse to intervene? Did the examiner say which of the client action? Because the question is not testing about the client. Is that the question is testing about the staff member. So if you don't have this perfect understanding of what you are doing in the question or what the particular person NCLEX is placing in that question is doing, then you will miss on the answer. That's why 55% of students selected this, 30% of students selected this, right? And then even like 15% of students selected this. And we have few students selecting this. It's bad. some understand the question, but they don't know the answer. Some do not even understand the question at all. I'm telling you, 55% do not understand the question and they just jump into saying, oh, the answer is 1. Right. You need to understand the question. We are observing, right? That's what we are doing. Now, which of the following action by staff member? The moment you are observing, it's just like right now, the what we picked out from that other question is change of shift report. And we said when we are doing change of shift report, what come after change of shift report is either delegation or prioritization. Now we've picked out something in this question, which is the action, which is observing. The moment you're observing, there are two things that come out from observing. Is either you're looking for the correct action or wrong action. So you expect the NCLEX to test one of these two, for crying out loud. Same way we expected the NCLEX to either test delegation or prioritization when we are talking about change of shift report. Now, that way you will never be lost because you will ask yourself, is the NCLEX testing correct understanding or wrong understanding? You will look at this question carefully to be sure. Now the question is saying which of the following action by the staff member would require the nurse to intervene? So it now means that the question is testing what wrong understanding. Because if the nurse is doing, it's just like now if you have a child and the child is playing, why do you need to correct the child when the child is not doing anything wrong? It makes no sense. Your child is doing everything right. The child is not doing anything wrong. Why do you need to correct the child? It's only when the child is doing something wrong you correct the child. So why should the nurse, right, intervene to the staff member action when the staff member is doing something, everything right? The only reason why the nurse is going to intervene to the staff member action is when the staff member is doing a lot of things wrong. And that is what the NCLEX is trying to test here. The NCLEX is trying to test you that one of these answers is related to the staff member doing something wrong. So all you now need to now do is to select that wrong option related to the care, because you don't just observe. There's a specific thing you want to observe. In this question, we are observing this staff member caring for a client with chickenpox. So we are like, okay, we are monitoring the care that this staff member is doing towards a client with chickenpox. So we need to now know the kind of care that chickenpox patients need, right? Which NCLEX has provided 4 different kind of care here. So we need to ask ourselves, okay, is care 1 related to chickenpox? Yes or no? Is care 2 related to chickenpox? Yes or no? Is care 3 related to chickenpox? Yes or no? Is care 4 related to chickenpox? Yes or no? That is just what you need to do. Simple. Okay, so now I'll move on to the next one. Next question. Right. So now, this next question right here, the body of the question, this is it right here. Now, the body of the question is saying the nurse is caring for a client who report feeling faint and is experiencing the cardiac rhythm shown in the electrocardiogram, also known as ECG strip below. So, meaning the body of the question is giving you one, the patient's finding or symptom, and also giving you what? The ECG reading. Right. So now what the NCLEX wants you to do is to understand the patient finding and as well to the ECG reading. So the moment you understand the patient finding and the ECG reading, right, you should be able to answer the question correctly. Now, let me tell you something. The moment you are looking at an assessment data or you are trying to assess, right, the whole goal of assessing is to look for problem. Right, because this is just like an assessment, right, on the client, checking the symptom, also going as much as possible to see what is wrong with the patient heart, because ECG is used for the patient heart, to see if there's a problem. Those are just assessment data, right? When there's an assessment data or when we are trying to carry out assessment, the next thing we are looking for is problem. And when we discover this problem, the next thing we are trying to do is to provide what? Solution. If you end up finding out that your patient has problem, for crying out loud, what is the next thing you are trying to do? Is to give them solution. Sometimes NCLEX can test to see if you can recognize if a patient don't have a problem. Not all the time, every question is going to be related to patient that have problems. Sometimes it might be, NCLEX might just tell you, look at this patient finding and look and see if there's a problem. Sometimes there might not be a problem whereby the answer will just be continue to monitor the patient because there's no a problem. But the truth is 90% of the time there's always a problem. 10% maybe there's no problem. Right, because the NCLEX obviously they are more of serious business than giving you question whereby there's no a problem. But I've seen question whereby there's no problem, whereby the answer is just to continue monitoring the client. I've seen question like that on the NCLEX exam. Right. So I'm just telling you because most of the time it's not a problem. 90% of the time there's always a problem. Right. So you discover what is the problem. The next thing is to find solution. So anytime the NCLEX is giving you assessment data or trying to tell you to assess, the next thing is always to intervene. The next thing is to start thinking about your nursing action towards that particular thing. In this question is related to ECG. So it's your strong knowledge about ECG that will give you the ability to answer the question. Now, when NCLEX want to test you about your nursing action, NCLEX can either test you related to the wrong nursing action or the correct nursing action. Right. It's like a 70-30 thing. 70% of the time, NCLEX tests the correct nursing action. 30% of the time, NCLEX asks you to select the wrong nursing action. So carefully read the question. Don't think because of you identify the ECG successfully, NCLEX wants you to find solution to the client. The examiner might just ask you which of the following is a wrong nursing action. And guess what? You will go and pick the correct nursing action. And you will think you know what you've answered. Guess what? And you selected the wrong answer related to the wrong examiner question. And you're like, oh my God, what did I do? I don't know. I understand everything in the question. This might be the reason why you are failing. Somebody reached out to me. She was like, Coach, I swear I knew everything in that exam. I don't know why I failed. It might be you understand the content and you don't understand it. You do not pay attention to the question. 2 weeks, I coached a particular student who was taking the PN exam, and she told me she's ready to take the exam. I say, how? How do you know? Because I've not even got into the evaluation part. She said, Coach, I'm ready and I know my problem. She said the thing is that she was unable to understand the question. She knew the content in the question, but she saw the mistake she was making. And one of those mistakes was the ability not to even understand the question. She was so excited that she knew what the body of the question is all about. She will go and select the answer. She failed to pay attention to this part that tell her what to do. Even if she pay attention to it, like she has already gave herself a meaning to that question. So even when she's reading this, it looks like she's reading it for fun. So it's not sticking. Right. I call this thing, it's common, right? We call it neuro block. Neuro block. You see, I know a lot of reasons why a lot of students fail this exam. Now, neuro block is whereby you are thinking about something, but your eyes is not saying that what you are thinking is not what you are thinking. Like, how do I explain it? Like, it's just a short period of time whereby your brain is just blocked based on what you are thinking. So you are seeing what is on the screen, but it's what you are thinking that you are seeing. A particular student kept on reading a particular question over and over again wrongly. I was like, what's going on? The reason why is because she was thinking about something. So that what she's thinking about, that is what she's seeing. So her eyes is not seeing anything. Her eyes is not sending what she's seeing to the brain. Instead, her brain has blocked just what she's thinking, and that's what she's saying. Like, take for instance, let us say she want to read this answer. She was like, administer the client digoxin. But it's beta blocker that is here. I said, oh, digoxin, read the question again. She said, yes, digoxin, administer the client digoxin. I'm like, we are saying beta blocker here, but you are saying digoxin. She just said, oh my God, sorry, coach. I was thinking about all this, so this and that. Now, because she has processed the question, she has started thinking about the necessary intervention to that question. So one of the necessary answer that she was thinking, I'm not saying this is not the question that we were doing that day. It's a different question, but I'm just trying to use this to explain. Right. So one of the things she was thinking was that we are going to use digoxin for this kind of patient. So she was trying as much as possible not to forget that answer, hoping that when she come to read the answers, she will see digoxin as one of the answer. So it now became what? A neuro block that when she was even seeing a different medication, She was not seeing that medication. She was only reading what is in her brain. She read that 3 times. Imagine 3 times. This is situation whereby there was no anxiety attached to it, unlike when she's taking the actual exam. Imagine if she's not taking the actual exam. Who is going to be there to not tell her that you are reading the wrong thing? Because I will not be there when you are taking the exam. It's what you read is what you answer. So that way, I saw that I was like, yes, and I know this for the past 2 years. I've coached 700 students, so I know my goal is not to tell you how to pass. My goal is to let you know what is making you not to pass. That way you can start knowing how to pass. Right. That way you will start knowing how to pass. Yeah. All you just need to just do is to show students the process. They will fill in the whole gap themselves. If you show students, if you don't show students the process, you just tell them this is what they just need to look at in order to pass. Trust me, they will come back to you for help because they are not clear. Clarity is what you want to give to students. So when they are clear, they can walk themselves through the process. They will not really need you as much as possible because they know what to do. Even if they need you, they just need you to just like make them understand what they already understand. Like many of my students will reach out to me and say, Coach, I know what this is all about, but I just want to be sure if it is true. That way I know you are taking charge of your studies. Not that, oh, coach, help me to explain this. I don't know what it is all about. This is 2025. Right? Your ability to take charge of your studying is what that matters because you will not keep doing coach explain this till the day of your exam. Then on the day of the exam, then me and you need to sit down close to each other on the day of the exam so that you can ask me more of those questions then. But the moment you take charge, you try to create understanding. If it's not clear, you reach out to me. Then that's the smart way to study. Coach, when I was reading this, I noticed that this is what I understand, but I want to be sure if this is clear. Then we are talking. Then I can start saying, okay, yes, what you said here is correct. What you said here is wrong. Let's fix this. Oh, what you said, everything is all correct. Good job. That is how to study for the NCLEX. You have audio too. There's nothing stopping you from failing now. The only thing that will stop you from failing is doing the activity. You have the test plan, you have the NCLEX pass question, which I'm using right now. All you now need to do is to do the job. Right. That is just it. Now, that is that for that
I
question.
have a
Now,
quick
this
question.
ask me, please.
Yeah, you spoke about the test plan and NCLEX past questions.
Okay.
I know where to get the test plan, but where do you get the past questions from?
Yes, still also available. Okay, let me show you. I can send it to you though, but let me show you so that you can see. All you just need to do is to go to the NCLEX website,
Okay.
nclex.com. So you see something like this. Now, if you want to get the test plan, just go to this prepare. This down arrow, you see the test plan. You'll be able to have access to the test plan. Below right here, we have the one for RN and we have the one for PN. Now, if you want to see the past question, when you go to the nclex.com, the past question is on the first page. Right, you see, I don't need to go to the prepare this time around. Instead, the first page already have the past question. Just go down right here that said NCLEX and EANS exam, right? And this place that we have right, get the exam preview and sample question. Just click on it. You will see sample question and exam. This one is for case study. This one is for the exam. The main exam, this case study part. So if you click on download, right, you'll be able to see the exam question. But you need to like fill up this detail and then they will take
Okay.
you to the page where the
Thank
exam
you.
question, where the exam question is right. The download sample pack is the case study, right? You also need to fill this information as well to be able to get it. Right. But I can send it to you so that you can have it as well too, right? So yeah, that is how to get it.
Thank you.
Well, please.
What do you say?
I say send it to Joy too as well.
Okay, I will send it. So I will send the test plan and I will send the
All right, thank
first
you.
question. You are welcome. Right. So that is how to get it. Now, the moment you have it, you have the ability to now start studying accordingly to what the NCLEX wants you to do. Right now. So this next question right here is saying the most.
Sorry, before you go forward. The other question you spoke about, what would be the answers? because I tried to answer the questions as you were showing it.
Mm.
And I thought you would say something about that particular question before you moved forward.
All right.
I just wanted to know whether I got the answers right or not.
Okay. This is what in my coaching program, this is, like I said earlier on, my way of evaluation is in three ways, right? One, the ability to know the content. Two, the ability to know how the examiner writes the question. Three, the ability to understand. Understanding is when you start deciding what is the answers. One, I need to know if you know the content. The content, I have already explained where you can get the content from. Right now, the student now need to learn the content. Now, if you know the content, you know how the NCLEX write the question. Because what I'm doing right now is to explain the writing style of the examiner. That's what I'm doing right now. It's not related to even answering the question. If not, I would have been saying the answers to the question. The last part will be understanding. But what I'm just trying to do today is understand, like knowing how the NCLEX write the question. Now, if you want me to evaluate your answer, first you need to let me know what the question is testing. That is one. When you let me know what the question is tested, then I know you have the ability to answer the question. I don't want students to answer a question when they don't even know what the question is testing. So if you want me to evaluate your answer related to this question, one, tell me the body of this question, what is it testing? So that way I can proceed. So tell me, what do you think the question is testing?
I think the question is asking about this reading, ECG.
You think the
Generally,
question is asking or the question is
I know
asking it? Okay.
the question is actually asking about the cardiac rhythm, which
Okay.
by my reckoning or interpretation would be bradycardia.
All right. So yes, it's bradycardia. So since you know it's bradycardia right now, so I believe the next thing is to give the right nursing action, right? Because the question is testing the appropriate nursing action. It's not testing the wrong action. So let me see.
Yes.
What are your answers now related to the question? Explain number one, number two, three, four, five.
Okay. I would not pick number one as the answer because it says administer the client's prescribed beta blocker. Beta
Mhm.
blocker is supposed to reduce the high blood pressure and make it lower. And by doing that, it's also going to bring down the heart rate. But
Okay.
this is already a high heart rate. So beta blocker is going to bring it down further, which is not going to help the patient. So that is crossed out.
All right. So if you say
And
it's already high heart rate, then that's why we need beta blocker then.
no, I didn't say this is a high heart rate.
Oh,
I
you said
said
it's high
beta
heart rate.
blocker. No. I said this is
Okay, maybe it's a mistake.
bradycardia.
Yeah,
Okay,
you said
yeah,
bradycardia. But when you were
yes.
like saying your other
This means
statement, you
the
said
heart rate
this is
is
a high heart
low.
rate. Mm-hmm.
Oh, okay. Maybe it was just a
Mistake.
mistake. It was an
Okay.
error. Yeah. So I said a beta blocker, or what I meant to say was the beta blocker in the process of bringing down the blood pressure, the high blood pressure, is also going to bring down the heart rate, the high heart rate, if the heart rate is high. But
Yeah.
in this case, the heart rate is not high; it is low.
Yeah. Great.
So if we administer beta blocker, it's going to bring it down further, which will hurt or harm the patient. So that is not
Mm-hmm.
the answer.
All right. Let me clarify something. I don't know if it is going to be useful for you on the NCLEX or maybe anywhere, right?
Mm-hmm.
Which
Yes.
is this? This is how beta blocker work, right?
Okay.
Beta blocker, the first intention of beta blocker is not to reduce the heart rate. But we have different kind of not to reduce the blood pressure, I mean.
Okay.
The we have different kind of antihypertensive medication. We have
Okay.
them because of the way they work. Some interact with the
Mm-hmm.
kidney, some interact with the heart, some interact with
Mm-hmm.
different kind of thing in order to reduce the heart rate.
Mm-hmm.
Sorry, the blood pressure, I mean. So beta blocker, the duty of beta blocker is to look at, to think, because the beta blocker is like, maybe it's the heart rate that is causing the blood pressure to be high. So the
Mm-hmm.
whole goal of beta blocker is to reduce the heart rate, because you said to reduce the blood pressure at the same time the heart rate will be low. Instead,
Okay.
it reduce the heart rate. That way the blood pressure fall down alongside with it. Am I making sense?
Okay. Okay. Yes, you are. But I want to confirm it. You said you're trying to say that it works to bring down the high blood pressure, but the
The no
main
the
duty is to
yeah,
bring
yeah, yeah.
down the heart rate.
Heart rate. Now, okay, okay, let me explain something. I used to tell students that blood pressure and heart rate work together.
Yes.
Now, your blood pressure, you know the normal range, your heart rate, you know the normal range, but we have beta cell in the heart. Now, this
Yes.
beta cell are the one that control if your heart rate should be low or if your heart rate should be high.
Mm.
It's just like now, if you are asleep now, your heart rate drop below 60. There's nobody that sleep with heart rate within this range. Your heart rate drop below 60. That's the reason why most time if you're in the hospital unit and somebody just waking up, right, and you check the heart rate, it can be around the 52 down to 60. It will not be really high. We understand that it's not a problem. Right,
Mm-hmm.
because you might see that and start saying, "Oh, this patient is having low heart rate." No, it's because they're waking up. Their heart is in the resting stage. I've done a lot of vital sign during night shift, something like that. You see, the heart rate is always low like that, right? It's not a problem. We understand. Even the doctors as well too. They
Mm.
understand, right? But beta cell is the one that control if the heart rate should be high or low. Why? Because their
Mm.
duty is to control the heart rate in order to help the blood pressure. Right.
Okay.
The more the heart beats, the more the blood will move to where it need to get to. Right. If the heart is not
Mm.
beat, because the heart rate is obviously measuring how fast the heart is beating. Right. Now, when the
Mm-hmm.
heart beats, it pushes blood along the artery to get to where you want to get. So if the heart rate is too low, the heart will not be able to push blood as much as possible.
Mm-hmm.
So if the blood pressure is having problem, let us say the blood pressure is low, let us say 90 over 50. Guess what? If you check the patient heart rate, I can 100% guarantee you, except if this patient has already gotten to the point of deterioration, the heart rate is always 100% going to be high. Why? Because the
Yes.
heart rate, the beta cell
It's trying to
realize that,
compensate, right?
God bless you. That's what I want to say, compensation.
Yeah.
Because the heart rate, the goal of the heart rate is to make sure the blood pressure is within range. So now the heart rate has noticed that the blood pressure is low. So it needs to increase the rate of beating so that the blood pressure can go back to normal. But guess what?
Mm.
If the heart give up and say, okay, we've tried our best, and then the heart blood pressure is not going, it will not start dropping. That will not be the other aspect. After compensation have failed, it will not start dropping. Right. So
Mm.
that is it. So that is the beta blocker function. It also have the same function with digoxin as well too. You see,
Okay.
digoxin
Quick
also
question. Sorry,
reduce
quick
the heart
question
rate.
over there because I was thinking of the digoxin when you were explaining the heart rate and how it pumps blood to the body.
Okay.
Does that mean that beta blocker also are in charge of contractility just as digoxin?
No. According
Okay.
to the mechanism of action for beta blocker, the goal of beta blocker is to just reduce the heart rate. The blood pressure will
Okay.
drop alongside with
Okay.
it.
Okay.
Right.
I get it.
That's the main reason why most times, right? Okay,
Mm-hmm.
let me just leave that aspect. Let me just go straight to the digoxin. Digoxin, the whole goal it's to like increase the
Contractility.
contractility of what the heart. So that is the whole goal. But he also have the ability to drop the heart rate as well too. But the main goal is to increase blood movement from the heart.
Mm.
So if digoxin is reducing the heart rate, it's not reducing the blood pressure. Instead, it's making blood leave the heart. But if beta blocker is reducing the heart rate, right, it's reducing the blood pressure. It does not have any intention in what you can see patients using a patient with heart failure using digoxin, using beta blocker. The whole goal of digoxin in that whole patient situation is to like make sure blood is leaving the heart. But the beta
Mm.
blocker is to make sure that the heart is not working as much as possible because if the heart have problem, the patient will leave having heart failure to having an enlarged heart, and then patient might likely need a new heart or something like that. So we use all this medication to manage heart failure patient, but they have different role. That's why the NCLEX wants you to know your medication in this triangle, right? You need
Mm.
to know the class that you are working with, the use, and the mechanism of action. It's very important because do you know the reason why? If NCLEX is testing related to medication, even if you don't know the name of that medication, but you know the class, when you don't know the name of the medication, you cannot place it in a particular class. But guess what? If you know the class of the medication, you know the use and the MOA, you can see the answer that NCLEX will provide, and it will give you insight of what that medication is used for. It's very powerful. Because I might not know that the NCLEX is testing me related to antiplatelets, but I know maybe NCLEX give me a particular medication that is an antiplatelet medication, right? Like clopidogrel, right? And then I don't even know what clopidogrel is all about, but I know antiplatelets, which is the class, but I never knew that maybe that medication is related to that class. But I know the use of antiplatelets, I know the MOA, how they work. Trust me, if I see a particular question and I just read the answer keys, immediately I already know what that medication is asking. In my head, I'm like, I'm 100% sure this medication will be related to this. Let me show you so that you feel it for yourself. Because this is how I have the ability to answer medication question, even when I don't even know what the medication is. That's why I say most of the time we just need somebody to just walk us through the process of understanding. It's not everything that you will know. It's not possible to know everything. You just need to know what give you the ability to have that edge. And that's what I have the edge. I've seen many students that I coach them. They are very smart. There are many things that they know, and me, I don't even know it, but they still fail the exam. So what is making them fail, and what give me the ability to pass? I'm telling you. So I've seen many students, they know their content. They will explain what they know, but I don't even go that far. I'll just say, well, this is just my own principle. Like now, even if I don't know what this medication is all about, right? Through the answer, I can start thinking about it because I learned using the class, the use, and MOA. Right. So if I see this for first answer, I'm going to read it. Notify your primary healthcare provider if you experience unusual bruising. You see, then I'm like, okay, what class of medication will cause bruising? In my head, I'm like, it's related to either anticoagulant or antiplatelet. So in my head, I'm like, this medication is 100% either an anticoagulant or antiplatelet. I'm going to read the other one. It's talking about avoiding over-the-counter medication with acetaminophen. Now, over-the-counter medication, sometimes there are two things. One, is either it's going to enhance the effect. We learn this in pharmacology. Is either going to increase the effect of the current medication you are using, or is going to decrease the effect. That is what over-the-counter always used to do. Right. Now, since this one is already screaming anticoagulant, in my head, I'm like, this one it look like the NCLEX is trying to test over-the-counter medication that can increase more of the effect of the medication. Imagine if you are using ibuprofen with anticoagulant or antiplatelet. Are you not increasing the chance of bleeding? You are increasing more of the chance. So it makes sense to me that that's why the NCLEX is putting alongside over-the-counter. So now I understand now. Now this one is not saying avoid driving your car for a short period of time till you know the response of a medication. Why would you teach a patient to avoid driving? Maybe that medication causes sedation, something like that. So the NCLEX is not giving me another thinking that maybe this medication is related to sedative agents. So I'm thinking about antiplatelet. I'm thinking about medication that cause sedation at the same time. Now, the question is now also saying we should obtain blood specimen every 3 months to check the serum albumin level. Now, NCLEX mentioned serum albumin level. This is related to blood. Now, those medications that are more related to blood, anticoagulant is part of it, right? Or antiplatelet is part of it. So I'm like, if NCLEX is talking about something directly related to blood, right? I know those medications that are directly related to blood. We have a lot. We are trying to check for maybe like our WBC or CBC, so in general, right? Thyroid level, all those kind of things. But this question is not, we are not thinking about thyroid level because nothing in the answer is related to thyroidism, nothing is related to anything. Everything just scream is either a sedative medication or a medication that cause risk for bleeding. Right. So now, how do I now identify fully well that this question is related? Because of these two answers. These two answers is already screaming because anytime NCLEX is testing over the counter or the understanding of over the counter is because Either that thing we are using alongside with the medication will increase more of the effect of that medication or reduce the effect of the medication. It's one of the two. Now, when I look at the medication NCLEX is putting, acetaminophen is not a problem to many medication.
Bleeding.
It's like a good thing. It's a good combo. So if NCLEX is putting that, I know this is not going to be a problem. This is out. Right. Serum albumin, we don't do albumin most of the times when we are doing medication check. It's not a common thing. It's like a 5% thing we do. We more do more of other things than albumin to confirm medication effect or something like that. So that way I know this one too is out. Now I'm left with 1 and 3, right? To know if this medication is related to what? Sedation, or if this medication is related to
Bleeding.
anticoagulant.
Or
Right.
bruising.
But these two answers right here that we X'd out is already screaming that this medication is related to um anticoagulant. Because why are we going to check blood? The reason why we check blood related to, and when this one is already screaming anticoagulant or antiplatelet, is because we want to check if this patient is not having something like maybe low red blood cell and other kind of stuff that can cause patient to bleed. So these two answer is already screaming it's anticoagulant. So me, I will know that my answer is number 1. That is one way. Two, shortcut is anytime your question is saying notify your healthcare provider. Anytime you are answering any medication question, right? Listen to me. And then the NCLEX question is saying notify your healthcare provider. That is 100% your answer. Mark my word. Anytime you're answering any medication question, and I'm talking about medication question, be it select or apply related to medication or it's a standalone question like this, and they're telling you to notify the healthcare provider, that is 100% your answer all the time. So it's like a shortcut,
Wait, let
right?
me confirm that. I'm sorry.
No problem.
You said every time they're asking medication questions
Yeah,
and there's an option for notify the provider, that will
yeah,
be the answer?
100%.
Hmm.
Right. And I will explain the concept. I gave you the shortcut, but I'm going to say explain the concept. The reason why is
Okay.
the way the NCLEX is written, the NCLEX want you to know the difference between side effect and adverse effect. Now,
Hmm.
side effect, we don't report it. But you see,
It's expected.
adverse effect, we report it. Right. So anytime the NCLEX is not like nursing school question that will tell you to notify the healthcare provider and then write side effects. NCLEX is nursing here. NCLEX don't have time to be missing information for you. This is NCLEX. This is not nursing school that wants you to differentiate between side effect and adverse effect. Anytime the NCLEX just put notify the healthcare provider, don't worry yourself to find out if this is a side effect or adverse effect. It's 100% an adverse effect because that is how NCLEX talk about adverse effect. Right. In nursing school might put side effect and test to see if you know this is a side effect. But NCLEX will not do that. That is not the writing style of the NCLEX. The whole goal of the NCLEX is not related to giving you confusion. It's related to seeing if you know what to do. Remember, you are teaching a client the right information to do. So if you are telling them to notify, this is the action NCLEX is trying to test. What follow it is an adverse effect. So the NCLEX is trying to test, the whole goal of the NCLEX is to test to see if you know you need to teach a patient that for adverse effect, you notify the healthcare provider. For side effect, it's an expected thing you don't need to notify. So that is just the explanation behind it. But that's why many students, you don't need the explanation. All you just need is just to know it like, okay, this is right. It's always that. Another shortcut is anytime you are seeing that a particular pharmacology question is talking about emergency identification, or you're just talking about identification in general, like you need to do something to identify your situation or something like that, is always the answer. Right. Let me see if there's one like that. Um Emergency identification. Emergency. Okay. Like now, see this particular question right here. When a lot of students were struggling with this question, I did not struggle with it because I understand concept of care, right? NCLEX is all about safety exam. That's the main reason why the safety answer in that question is to notify the healthcare provider because adverse effect will kill the patient. It's no joke. It's the highest safety related to that question. Now, this is also pharmacology, and NCLEX is looking for the highest safety. Right. Now, I want you to like read this question and answer it. Let me see what would have been your answer. Are you there?
I'm here. Okay.
Read the question and answer it.
The nurse is teaching a client who is receiving newly prescribed propyl fluorosil. I don't even know what that is. Which of the following information should the nurse include? Carry emergency identification with you, listing your condition and medication regimen. The medication dose will need to be reduced if you develop a granulocytosis. You will experience weight loss if the medication is effective. Increase your daily intake of foods and foods containing iodine. According to what you said whenever there is emergency identification, you said that would be the answer, right?
Yeah, but I want to know your answer. What would have been your answer? It might not be emergency. This question just have emergency. Sometimes it might just be carry
like
your
an ID
identification band. Eh?
Yes, I've seen questions like that that would ask for the ID band
Yeah,
and
exactly,
stuff
like
like
something
that.
like that.
Yeah,
So I'm just
yeah,
only telling you if you have that identification, it's very important. It means that there's a safety concern related to that medication. So it's a
yes.
shortcut, is always the answer.
Wow,
Right. But
okay.
what
Thank
would
you
have
for
been your
that.
answer if you had to look at this
Normally,
question
I would have guessed because I have no idea what
of
this
the
med is.
medication? Okay.
Yes, I would have guessed. Maybe I would have picked a granulocytosis.
Why?
Maybe.
So why would you pick that?
Because um, it says the medication dose will need to be reduced if you develop a granulocytosis.
Mm.
I really have no explanation for that. But I would have picked granulocytosis because maybe I would have thought in my mind that this one, because I know there are some meds that um, deal with uric acid.
All right, but
And uric acid,
that would be
that
like overthinking because our goal is
I
to
know,
think within
I
this
agree.
question.
I agree. I have no idea what the med is, so I would have just guessed it.
Okay, now let me show you the difference between guessing and understanding so that we can walk
Okay.
through the process. Yes, there's one thing not to know the med, but there's one thing to also have understanding of pharmacology. So I don't know. It might be a problem with pharmacology knowledge that you have, right? But let's walk through the question. You will see what I'm saying now. Now
Okay.
let us act like we don't know this medication.
Okay.
Let's just erase it out. Let's exit out from our thinking. Right. And let's focus on the answer. We are smart nurses, right? Look at the question. It's saying, which of the following should the nurse include? Now, the question is testing the nurse. Remember, I said you need to know your role so that you don't miss the action that you're going to give. If the question is testing related to charge nurse, so the answer should be related to charge nurse role. If the question is testing related to any other person, it should be related to that person role. Now it's the nursing role. So your answer is related to nursing role. So they are
Mm-hmm.
nursing role. Now, I want you to know something. In nursing, we do collaborative care. The aspect of giving patient the IV treatment, or maybe IV fluid, this is a collaborative care because you did not prescribe that for the patient. Right? You got the
Mm.
prescription from the doctor and you carried it out. Right. So everything in nursing is related to collaboration. So if NCLEX is testing you question, you need to read that question carefully and ask yourself, is this my scope of practice?
Mm.
Because NCLEX wants you to know your scope of practice so that you don't select answer that is not within your scope of practice.
Mm.
So in this question, what are we doing? We are teaching. So when we are trying to teach the patient, we should teach the patient based on nursing knowledge and nursing understanding, not something that is not within your scope of practice. Now, the first one said carry emergency identification with you, right? listing your condition and medication regimen. Let us just say that one you don't even understand that one. Maybe you will keep it, come back to it or something like that. Now let's go to number two. The medication dose will need to be reduced if you develop this condition. Now, everything you are thinking, when you realize your question is related to pharmacology, the first answer, I understand pharmacology so well. I don't know many of the medication, let me tell you the truth, even till now. But I understand the principle behind pharmacology. So that is what is helping me out. Now, when I don't know the medication, but I know that this question is related to pharmacology, I'm going to ask myself, in what situation do we carry emergency identification? So in your head as a safe nurse, you know there's a situation with this medication, that's why it's important. Why would you tell a patient to carry emergency identification if it's not important anyways? So it makes more sense that there's something about this medication that is very important that this patient need to carry emergency identification. I remember the principle of the NCLEX, safety. And there's high safety when it comes to medication. So that makes sense and starts striking you so hard that number one is my answer. Number one is my answer because you understand the nature of the exam you are doing, you understand pharmacology. So these two combinations make you start thinking one might be a possible answer. You see how I'm walking you through the process of thinking. Now, look at number two. The medication dose will need to be reduced. The next thing you ask yourself, okay, this is pharmacology. In what situation do we reduce medication? That is if there's a problem, right? Now, guess what? They gave you a problem, which, trust me, this is a life-threatening problem. But the mistake right here is the nurse don't tell patient to reduce medication. The doctor might decide that, but not you. That is not your scope of practice to tell patient to reduce medication. Our scope of practice is to tell the patient to notify, just like that other question we did about clopidogrel. Our scope of practice is to tell, even if the patient is having a side effect, right? Our scope of adverse effect, not side effect. Our scope of practice is to tell the patient to notify their healthcare provider. Now, the healthcare provider cannot decide if the patient should stop or reduce. But this question is asking what? Nursing information. So nursing information don't have anything to do with reducing. If they ask you why do you tell the patient to reduce the medication, would you tell them that you were trained to tell patient to reduce medication? No. The only thing we were trained to do as a nurse is one, which when we are in the hospital settings, is if we notice that a particular patient is reacting to a particular medication, what we're taught to do is to stop it. That's what we're taught to do. And it's only when we are in the hospital settings we have the ability to stop or hold. But when the patient is leaving the unit and we are trying to teach them about their medication, right? We don't have the right to tell the patient to stop or hold or reduce. Now it's now they and their doctor because they have left the hospital unit. So you need to understand the aspect of teaching patients for medication. That's why I always used to tell them, pay attention to the question. This question is not just testing your knowledge related to medication, it's testing teaching. When do we teach patients about their medication? Why or when or why do we teach? Because we wanted them to keep up with their care. So the ability for them to keep up with their care, you need to let them know the real information. Oh, the nurse asked me to reduce my medication. You'll be liable for it.
Yeah.
Right, because there's some medication you don't just reduce it like that. Right, so it's the doctor duty. So that's why that number two is out. If you understand pharmacology so well, you will know this principle. It's a principle in pharmacology. It's not many students run away from pharmacology, so they miss out on this easy principle. Right, there are a lot of it. Some people don't know the reason why you give medication in the morning and why you give medication in the night. Because they are scared of pharmacology, they do not even learn the most easiest part of pharmacology because they are scared about it. Now, look at the next one. It's saying you will experience weight loss if the medication is effective. Now, this answer is testing how do you identify the effectiveness of medication? Except if that medication will intentionally work for losing weight, right? There's no medication that the effectiveness is weight loss. A patient can use furosemide, right? But the effectiveness of furosemide is not weight loss. Guess what? A patient who have heart failure, right, can weigh 200 lbs. And when they use furosemide, they can drop all the way to 180.
Yeah.
right?
Increase urine output.
Exactly. But it's not the weight loss that is the effectiveness. Yes, they use the furosemide, they lost weight, but it's not because they lost weight that the medication is effective. How do we monitor for the effectiveness of furosemide? Is the urine output. Previously, before, patient is having less than 30, but now patient is not having like more. They're having like 120, but our normal range is 30 to 60. Let's say they even have like 120 or more in an hour or something like that. Now they have like increased output, urine is now coming out. So what do you expect? A patient that it's liquid or fluid that is in the body before, now we have given them medication and then they have lost the weight, and it's not the weight, it's just the result of the effectiveness of the medication that caused it. But it's not the weight that we are using to monitor the effectiveness, because if the kidney don't remove that fluid, because the medication, how does the medication work? It goes to affect something in the kidney that enhance the release of those fluid. If not, let us say, okay, if it's the weight, then let the fluorescimide go and touch something in the patient's weight and let the patient reduce weight. But that's not the usefulness of the medication. It goes to touch something in the kidney to bring the fluid. So how do we monitor that the kidney is already doing what it needs to do according to the instruction of the medication? That's when we check the
Urine
output.
output. Yes.
So if you know what this medication is all about, then you can now know the effectiveness. This medication, right, we are acting like we don't even know it. So we might not be able to differentiate or know the effectiveness if we don't know the name, the usefulness of the medication, but we can still keep it. But we're 100% sure two is not correct. We are still between like 1, 3, and 4 is saying increase your daily intake of food containing iodine. Now,
Mm.
many answer on the NCLEX exam related to um increasing daily intake of something is always wrong. Many answers.
Mm.
Few are right, but more are wrong, because we don't want to tell patients to increase something. Instead, we want to tell them, look at the keyword. You say, I'm going to change the keyword so that you will see all these things on the NCLEX exam. NCLEX prefer to use maintain your daily intake than increase it, because we don't know to the extent at which patients will increase what you are telling them to increase. Some people might go beyond, because increase is not specific, increase is vague. Some patient will
Mm.
say, "Oh, the nurse said I should increase, so I thought maybe 200 grams is what I need to take, but since that's what I feel." And then the patient might supposed to maybe take 100 grams of what they are taking. And you say, "Oh my
So
God,
you're
yes, I
saying,
told you
I'm
to
sorry.
increase but small." Huh?
I'm sorry to just cut you short. I didn't want you to go beyond this
All
place
right,
where I
no
could ask a
problem.
question. So
No
you're
problem.
saying if they put a like an amount to it, for example, if they said increase your daily intake of something to 100%, that can be
Exactly.
correct,
Then
right?
NCLEX is testing you on the amount.
Okay, I get it.
So NCLEX is
I
testing on the
get it.
amount. It's just like now. NCLEX is saying, oh, it's just like now. Patient is saying, I will make sure I only take 300, let me say, maybe, let me say like a particular amount, let me say maybe around the 300 amount of like sodium, right?
Mm-hmm.
Or salt or something like that in a day or something like that. Then the NCLEX
Mm.
is testing on the amount, right?
Okay.
Then that way you evaluate, is that too much or not,
Okay.
right? So NCLEX prefer the keyword. I'm teaching you NCLEX way of thinking. NCLEX mostly don't like something that is not specific and is vague.
Okay.
The moment you are teaching a patient to increase something, you need to tell them the amount they are taking. It's just like now, if a patient is on anticoagulant, we want them to also be on what? Um, Vitamin K diet, right? But
Mm.
we don't tell patients to increase their daily intake of vitamin K diet, because we don't know how much they will increase it to. And guess what? If they increase it more, it's going to not make the medication effective.
Mm.
Instead, NCLEX is going to use maintain your daily intake of vitamin K rich diet,
Mm.
because we want them to maintain and not to add to it and increase or do more than expected.
Mm.
So I'm giving you this shortcut because I don't want you to go on the exam and start asking, should we increase our daily intake of so and so? Guess what?
Mm.
Is the key word NCLEX is testing because it's teaching that we're talking about. NCLEX is
Mm.
not testing the right information that you want to teach. Because in this case, we might be asking ourselves, oh, is iodine something that we need to tell the patient to take? No. The patient can take that iodine, but not as much as increasing it because it's going to cause problem to that medication.
Yes.
So when you are thinking of the iodine, NCLEX is thinking of teaching the patient to increase. Because the moment you are teaching the patient to increase, you need to put an amount to it. But no amount is
Okay.
there. So how do you expect the patient to maintain the right thing? The moment you are thinking the NCLEX is testing you on agranulocytosis, instead,
Mm.
the NCLEX is not testing you on that. Instead, the NCLEX is testing you, should you tell a patient to reduce their medication?
Mm.
You see, the moment you are thinking about what kind of condition and medication regimen should the patient list, instead, the NCLEX is not testing you on that. Instead, the NCLEX is testing you on the ability to recommend to recognize what it means for patient to identify situation like this in emergency case. That's what the NCLEX is testing. So when
Mm.
you are seeing a different thing, I'm seeing a different thing, and then I know how to answer the question. This is my edge when it comes to answering question. Right. And I've taught this to many students, and when they realize this, they're able to pass. Now, to end it all, right, I'll just tell you about a particular student. There's a particular student, right, in nursing school. Uh, she always like if anybody is taking the exam for 1 hour, they gave her privilege to take her exam for 5 hours. Why? Because she have this anxiety problem that caused her to vomit, go to the toilet, back and forth, back and forth. Right. So she got that privilege. Right. Now she started with the LPN program. She took the exam. She said she was going back and forth as well too, but by God grace, she was able to pass the LPN. She finished that. She wanted to take the NCLEX exam. The same problem, back and forth, but she ended up failing the RN, NCLEX-RN exam because she did everything and then she wanted to proceed to RN. Right. And then she reached out to me. She said, this is the problem, this and that. I told her one thing. I said, if I tell you that the NCLEX is going to test you, all your 1 to like 85 question will be related to plus minus, like maybe the NCLEX will say 1 plus 1 equals to 2, or 2 plus 2 equals to 3 equals to 5, something like that. Would you be scared of the exam? Would you have situation whereby you have to go to the toilet multiple times? She said no. The reason why she will say no is because this is very clear that even if they wake her up from sleep, she will be able to answer this question. So if I tell you that this is what you are going to see on the exam, she will never even have to go to the toilet back and forth, vomiting, having anxiety, because she know how to answer this question. So now let us look at the NCLEX as well too. Now, the moment you know how to answer the NCLEX question, you know how to go about it. And you're 100% sure you can answer the question. When you go on the NCLEX exam, you are also not going to have this anxiety. The reason why a lot of people have high level of anxiety is because of the fear of the unknown. Right. The fear of the unknown. If you are walking in the dark, you are scared. If you are walking when there's bright light, you are not scared. Now, understanding this, all I just want to give to you is what the NCLEX is all about. The moment you understand this, you implement it, because it's not about understanding, it's also about implementing. I cannot be teaching you how to drive without you not driving it yourself. Because if you don't drive the car yourself, guess what? You will never understand. You will never know why I'm pressing brake. You don't know why I'm accelerating. You don't know why I'm changing from one gear to another. You will not understand these things until you actually do it. So now, if I'm like teaching this pharmacology now, and you don't actually go to some certain question to understand all these concepts yourself and see how you can be able to use these similar things as well too. Guess what? You on the exam is not that, it's not on the day of the exam that you start doing all these things. So I made her to know what will be tested on the exam, how she can approach it, and how she can understand it. These three same thing, the WC, the CWU. And then when I did this with her, she had the ability to what? Pass the exam successfully. Trust me, she did not even have to think about what. According to her, I have a story on the the group. Most people I just added them to the group, so I don't know. And WhatsApp cannot retain those things except if I send it again for the second time. Right. She did not even use the toilet at all this time around. And she was able to pass because she was asking me, what do you think? Do you think I should message NCLEX to tell them that I have this social condition that they should extend my date, so my time for taking the exam because they told me I can be able to do it. Like our school recommended her to reach out to the NCLEX. It's on the NCLEX. If you have maybe like a particular problem, you need more time to take the exam. Yes, in as much you have your thing for it, trust me. Right. Or doctor recommendation, anything they always use to that, I don't know, right? They will be able to give you more time. Right. Even when she used medication for her situation, it was not even working because it's beyond. Right. But see now, she's a registered nurse just by knowing three things: the content, how the examiner writes the question, and understanding. And you see, many people will go straight to telling you, oh, the answer is number one. But no, I don't go straight. I tell you what the examiner is testing, how the examiner writes the question. Like I told you, NCLEX more prefer to use maintain than increase. So now when you see a question saying increase, it carry more red flag than good finding. Except if you understand that question so well that you can easily say, yes, in this case we increase. The only time we are trying to increase something in nursing is if the patient lack that particular thing, such as increasing, like it's just like now the patient is having like low blood pressure and then maybe they are on a particular IV fluid before and then we are like, oh, the patient blood pressure is still getting low, we can increase the IV fluid. Or patient oxygen is low and then with the patient is on a certain oxygen, the oxygen is low, whereas they are having a specific oxygen amount, we can increase that oxygen, right? But we must make sure it's within our scope of practice, right? We can teach patients about diet is within our scope of practice. But when it's related to like medication, we cannot teach patients to increase the amount of medication that they are taking, even if they are not seeing effectiveness. That is the medical doctor information, right? So there are some certain things you just need to be careful of what that question is asking. The moment you understand the nursing art principle of care, you'll be able to answer the question correctly. Any question before I go? Any question before I go?
Yeah. Can
I
I?
have a question. Oh, okay. Go
Okay.
ahead, Joy.
So, yeah. Thank you. My one question is when they say pause and hold, is it the same thing?
Pause. I don't recognize that term in
Oh,
nursing, but the according to like English, I feel they are the same.
oh, okay. Thank
Right,
you.
but nursing term is more of old.
Hold.
I'm
Okay.
sorry. I'm sorry. Something made a loud noise here. I didn't hear what her question was. Could you?
She said when you see maybe pause or old, right? Are they the same thing? Pause or old? Pause, old
Oh, okay. Okay.
can mean the same thing, but the one I recognize in nursing and NCLEX is old. They are the same thing. You are like you see a reason because before you give a particular treatment, it's not only medication, any treatment. The way NCLEX want you to think is what do you do before you give that treatment and what do you do after? Because trust me, you can give the right medication to the right patient and still kill the patient. Do you know how? Because guess what? Beta blocker is used for patients who have what? Hypertension. But you can have that beta blocker and a patient who have hypertension and the patient will still die if you don't do the right thing. Because the patient might have a particular condition that is contraindicated to the beta blocker, such as maybe asthma. If you give a patient beta blocker and they have asthma, you kill the patient because the patient will come with tightness of the airway and then patient will die. So that is why treatment is important, but you need to know why you are not giving the treatment. Protein is very good to the body. It helps with muscle, and it also helps with like healing of tissue. But guess what? As very good protein is, you cannot give it to a patient who have kidney problem because when the body is retaining protein, it goes to the brain, and then the brain will develop what neurological issues. So protein that is good can also still be bad for the patient. So you need to understand when you are recommending protein diet, you need to know the patient condition as well too. So that's what NCLEX is all about. NCLEX know you have all this knowledge to every aspect of care, but NCLEX want to know, can you give it safely? Should you give a patient beta blocker when they are on insulin? No, because it's going to mask the effect of what? Of what they calling it?
Hypoglycemia.
Hypoglycemia. So these are things that you want to know. It's not that, oh, the patient is not having this or having that. Yes, we NCLEX know, yes, you are smart enough. You know this is correct, but NCLEX is not about what you know is correct in nursing school. NCLEX is now about, now you know these things are correct, but can you use them in a safe manner? And use them in a safe manner. That is what the NCLEX is all about. Right. So yeah, that is how you think as a nurse that is going to pass the NCLEX exam in 85 question. Any other question?
Yes, I have a question.
Ask me,
When I
please.
was going through the prioritization and delegation paper,
Okay.
um, the study guide that you
Okay.
sent me, I noticed somewhere that you said whenever there is a medical condition in a certain problem or in a certain question, the
Mhm.
medical condition is not the priority.
I said wherever there's a medical what
Yeah,
condition
when you're answering questions relating to a medical condition, I mean to priority, I'm sorry,
for
relating to
prioritization.
priority, yes, that
Okay.
the one that has the medical condition is not the priority. I tried to read further to see if there was a reason for it, but I didn't see it. If you go to the rules for NCLEX prioritization, it's right here on it says if one client on the list
Okay, I
has
understand what you are saying. Now you are now
okay.
explaining it accordingly to what I put right there. So I was like, I did not say something like that. But now that you are reading directly now, let me explain.
Okay.
Read it again. Read it again.
It says if one client on the list has no medical condition while the
Mm,
others do. Oh,
exactly.
okay. No, now I get it. I
Okay.
thought it was saying something about if they have a medical condition
No.
while the others don't. I put it
No.
the other way around. Okay, I get it. I get
Okay.
it.
Like
Yeah.
this is the example right here. Now, if you look at
Yes.
this particular question right here, now let me
Mm-hmm.
teach you something about nursing. Now, as a nurse, the first thing we always used to do when we see the patient is this. When we see a particular patient, the whole goal is to understand why the patient is having the problem they are complaining about. If we ask the patient, do you have any history of any chronic condition? If they tell us yes, then we will link all those findings to that medical condition. But
Mm-hmm.
if they tell us no, then we need to carry out vital sign assessment and head to toe physical assessment
Assessment.
to find out what is the problem.
Mm.
Right. So it's very dangerous, right, when you have a patient with just symptom and unknown condition. But it's still safe that we have a patient with their condition and their symptom. If you look at this question, right, when you're trying to prioritize, we more want to even prioritize patients that don't have a condition and just symptom than patients that have a condition and symptom.
Mm.
Because if NCLEX give you the condition, there's likelihood that everything this patient is experiencing is related to the condition. Unlike this patient that don't have a condition as well too. These are your acute situation. Acute situation is, are these things new to the patient or they are related to a condition?
Mm.
You understand? So
Okay.
these things are
I
new to
understand
the
what you're
patient. All these
saying.
things are new to the patient because there's no condition that we can link it to and say, oh, maybe it's this condition that is causing it. Right?
Mm. So it
Unlike
is
this
acute.
has a condition and it has what the patient is experiencing. According to the NCLEX, this patient can go. These ones
Yes,
that
they
don't
are
even have a
chronic.
condition, these are fresh situation. Let's pay attention to
Yes.
this. That's why it's a prioritization.
Hmm.
Yes, all these patients might have problem. Imagine this patient is having increased respiratory rate. This patient is having
Yes.
92 oxygen. It's important, but guess what? When it comes to priority, our priority is even more of all these patients that don't even have a condition than this one that have a condition. Because these situations are new situation. What of if this
Hmm.
patient is having this problem because they have MI? So because we don't see the condition, that is why we need to pay attention because we don't know. We need to rule all these dangerous conditions out. Because we don't know if it's heart failure. A nurse know how heart failure can kill the patient. So she knows she needs to take care of this patient now or later. But you see all these patients that have just symptoms. We don't even know what they're having, whether they're having brain damage, whether they're having MI, whether they're having different kind of conditions like stroke. It's just
So
like
they'll
now,
take
they are
priority
telling
over
you
the one that
they will
is
take priority.
signed.
It's just
Okay.
like right now, see something. A patient is having slow speech, and another patient is having heart failure, right? And respiratory rate is 22. Who is going to be your priority?
Love speech.
Slow speech, right? If you go on ChatGPT, if you put this information as well, to slow speech is going to pick. Guess what? When ChatGPT will explain it, ChatGPT will tell you probably maybe that patient is having neurological problems such as stroke. You see, NCLEX, we do not give ChatGPT the condition, but ChatGPT started thinking about the condition because ChatGPT understands the principle that I just gave to you now. So that heart failure, ChatGPT will tell you it's like something that is part of the disease process. So because of we understand the disease, we know how that disease can kill the patient. But that slow speech, we don't even know what is causing it yet. So that's why it's more of a priority than the heart failure. Do you get what I'm saying?
Yes.
All right. So that's where we'll now look at our answer. Now, when we look at the first answer, we say, oh, patient one is fine because they are not having any neurological problem. They said briskly reactive
They
pupil.
have
So patient one
reactive
is fine.
pupils. Yeah.
Restlessness, distended femur abdomen. These are different
We
body
don't know
system. That
what's
is a
the
problem.
problem.
That's a
Yes.
problem. This one, their blood pressure is okay. Their pulse is okay. That patient is fine. You are left with two.
Yes. Mm-hmm.
So that is the critical thing. And many people will not teach you like this. That's why I try as much as possible to explain nursing care. I don't like just bringing you straight to. I want you to have the ability to think because it's not just going to help you just on the NCLEX. It will help you when you start working as a nurse as well. Any other question?
Yeah, could you please not forget to, please remember to send us the information you said earlier.
Yes, please.
Yes,
Yeah.
I will definitely send it. I'll
Yeah.
send it immediately now.
All right. Thank you.
It was a worthwhile evening. Thank you so much, Coach.
Good night.
You are welcome.
So
You
when
are
next are
welcome.
we meeting?
Next meeting will be on Saturday.
What time?
Saturday, same time?
Yeah, we can do the same time by 7 p.m.
Okay. Thank you.
All right.
Oh, I
Are you available by 7 p.m.?
hope Saturday. What date is that? Let me see. Would that be on on the 1st?
No.
No, Monday is the first.
Oh, okay. Okay. Yes, I'll be available. Thank you.
All right, great. If anything changes, just let me know.
Okay, of course.
Yeah, I'll be available.
All right, awesome.
Mhm.
I'm glad.
Yeah.
All right. Have a good night,
More
everyone.
help.
All right.
Good night. I need some help with the what is it? The boot. Oh, bow tie. Bow tie. And
Good night.
also
Oh, okay. Let me listen in.
some more on the that 1 to 6 NGN. Because I
Okay.
mean, even though you
That's
did
case study bow tie chat questions.
yeah, because I mean, when I took the boards before and failed,
Mhm.
I had 2 bow ties and I couldn't understand it. And then I had like 8 NG that 1 to 6 question. Then I had
Wow.
some more questions. Some it looked like case study, but it really wasn't. But I mean, because it was set up like it, but it was only one question.
Yeah, that's what I
Oh,
said.
standalone.
NGN include chat question,
Yes,
case study, and bow tie. So the one you
and I
saw that
had
is one question,
4
that
of
is chat.
those. I had 4 of those. So
Yes, those are chat questions.
they were like seriously killing me. I couldn't understand it.
They are not difficult questions. I even prefer to have those kind of questions than
Well,
any
I
other
wish
question.
I had understood it, but oh my God, I was having such a tough time with it.
I understand. Once I
Oh my
break it
gosh.
down for you, you understand it. It's not difficult.
Oh, okay. Thank you.
All
Maybe
right.
we'll expect that on Saturday.
Exactly. That's what I wanted to say.
All right.
Because yeah, we'll do that on Saturday.
Joy, sorry, Joy, do you remember any of the content that the bow tie or the case studies had?
Oh God, no, I don't. I never. That's my problem. I always had that problem. Once the exam is finished, I don't remember anything.
That's it.
I just feel like I'm just lacking knowledge. Is why
Mm.
I'm not remembering anything.
Yeah, it's okay.
I understand.
Alrighty.
No
Yeah.
problem. We are going to kill it on Saturday.
Okay.
Yeah, we'll kill it.
All right.
Thank you so much, guys.
You're
Okay.
welcome.
Yes.
Have
Good
a
night,
good night.
everyone.
Good night.
Okay. Bye.